Monsoon is rain-drenched landscapes, romantic drives and cozy evenings with the loved ones. But the rains bring along with them a barrage of health problems that can be downright uncomfortable. Other than excessive humidity, it is also the time where fungal infections show up, the ugly fangs. Most of these problems are not life-threatening, but the unwillingness to visit a doctor or a dermatologist can up the risk and severity of the condition.
The high level of humidity and constant temperature changes during monsoon increases the risk of skin problems, and skin infections are the most common complaint.
Fungal infections are one of the most common superficial skin infections which are very common during the rainy season. So one should take adequate preventive steps to counter these fungal infections. There are certain high-risk groups, especially the diabetics which are uncontrolled, and people who are working in hot and humid weather and which are wearing tight clothing, and so these people should take adequate precaution.
The hot and humid weather is extremely conducive to fungal infections. Therefore, taking precautions and proper skin care is required during this weather.
Primarily, one should take special efforts to maintain good hygiene, which can be taken care of by avoiding to wear wet clothes and, if possible, avoiding to work in hot and humid conditions. If somebody has to work or somebody has to work in a hot and humid environment, then they should be wearing weather appropriate clothing, which should not be very tight and which should primarily be 100% cotton as much as possible. The use of starch-based talcs which are impregnated with antifungal are very common and very effective and should be used. One should avoid putting excessive oil, or rather no oil application is highly recommended. Also, to discourage the use of over-the-counter products, majority of them contain topical corticosteroids and which can cause intense harm. So all these over-the-counter products should be totally avoided as much as possible, and any topical application should be used with explicit recommendation of a dermatologist or a doctor.
Avoid self-medication in case of skin infections. Consult a dermatologist and take complete treatment to avoid any further infections. Kiran Bhardwaj, DD News.